Do you suffer from excess supination? Warning signs and remedies for this running problem. Both supination and pronation are terms used to describe the rolling motion of the heels and feet during the body's gait cycle, which takes place as we run or walk. Supination describes the rolling outward motion of the foot, therefore oversupinators don't roll their root inward enough. Excess supination is also called underpronation, since supination is the opposite of pronation of the foot, rolling inward. 1. Both oversupination and overpronation put too much stress on the underneath or outside edges of the foot, often leading to leg pains. For most adults, too little supination is usually more of a problem than too much, but oversupinating the foot can also lead to complications. Who tends to struggle with supination problems most often? Runners with high arches, the opposite of flat feet or collapsed arches, and tight Achilles tendons tend to be underpronators, supinators. 2. Some of the aches and pains associated with supination abnormalities include rolling or spraining the ankle, developing hammer toes, clawed toes, Achilles tendinitis, running injuries like plantar fasciitis, shin splints, iliotibial band syndrome affecting the knees, along with general instability and weakness. The reason underpronation, or someone with excess supination, causes such an array of problems is that the muscles in the legs and feet become trained to push the foot away from the ground with mostly the outer toes, pinky toes. Considering these are generally weak areas of the feet, they tend to bear more weight and pressure than they can handle, sometimes causing scar tissue to form. Other overuse injuries can occur, too. You can see why it's not just the feet that are impacted by supination or related postural problems, but rather these can contribute to muscular compensations that wind up affecting the entire body. What is supination? Supination, underpronation, is the insufficient inward rolling of the foot after landing on the ground. Compared to those with normal, healthy posture of the lower body, those with oversupination roll the foot outward too much, less than 15% of an inward roll when landing. This causes the ankle and only a small portion of the outer toes to absorb shock when the foot hits the ground, often triggering pain in the ankle, foot and lower leg. 3. As the body moves, in order to accept weight onto one leg and propel forward, a shift in weight must occur at the feet, knees and hips. A natural amount of supination occurs during the push-off phase when propelling forward. Supination helps the heel lift away from the ground, which brings the forefoot and toes down to land in a way that moves the body. However, too much supination contributes to common running injuries due to instability in the ankles. Weak ankles set the scene for postural problems, as well, like too much pressure applied to susceptible areas of the lower legs and higher risk for spraining. 4. Preserving proper alignment through the midline of the body, all the way from the head to the toes, by keeping the feet symmetrical and rolling them properly, is crucial for learning normal weight transference, which protects the whole body, including the spine. Causes and symptoms of supination problems. Some of the reasons that people develop abnormalities related to pronation, supination, dorsiflexion and other motions of the feet or legs include genetics. Genetics affect the length of the legs, width of the feet, stability of the ankles and curvature of the foot's arches, for example. Walking on flat, hard surfaces, rather than natural terrain. Wearing worn-out shoes, or those that are unsupportive. Muscular compensations due to poor posture in the legs, sacrum and spine. Old injuries, including ankle sprains, stress fractures in the legs or tendon tears, which can leave scar tissue behind that causes instability. Poor form when running or exercising. Overuse, including exercising too much or standing for long periods. Limited range of motion and stiffness due to aging. Loose ligaments or loss of cartilage in the joints of the feet or ankles, such as those of the sutalar joint. In some cases, leg discrepancy, legs are different lengths. Weakness in the ankles or lower body from too little activity, a sedentary lifestyle. Here are some common signs that you're likely an oversupinator, underpronator. 5. Frequent ankle sprains. Pain underneath the feet, in the ball of the foot, or pain often in the ankles. Clawed toes, hammer toes. Throbbing or weakness gets worse when running, walking, exercising or standing for a long time. Dysfunctional musculoskeletal problems in the ankles, calves, outer thighs or knees. Swelling in the ankle, foot or heel. Sometimes the toes are affected as well and develop calluses or bunions. Loss of functionality and reduced range of motion in the lower body. Supination versus dorsiflexion. Supination and dorsiflexion are terms related to motion and stability of the feet and ankles. They can sometimes also be applied to other body parts that bend back, like the hands. Deviations, abnormal amounts, of ankle supination or dorsiflexion are usually used to describe form and postural problems that cause common running injuries when the foot strikes the ground. These can include injuries like plantar fasciitis or shin splints, runner's knee, heel spurs, and Achilles tendon pains, among others. While supination describes the outward rolling motion of the foot, dorsiflexion describes the bending backward of the foot. Dorsiflexion decreases the angle between the foot and the ankle. In other words, it means the toes are lifting up and away from the ground, toward the ankle, body. 6. Proper dorsiflexion is also needed to bring the knees over the ankles, such as when bending over, squatting or jumping forward. Abnormal dorsiflexion, or backward flexion of the foot, is a common problem related to not only running injuries but those caused during other sports, exercises. Proper mobility of the ankle is crucial for allowing the body to propel forward, especially when jumping, sprinting or running quickly. Without enough ankle dorsiflexion, it's also hard to sustain proper form when performing resistance training using the knees, such as squatting or lifting weights. The torso can't remain vertical due to stiffness in the ankles, too little dorsiflexion, therefore you can't keep a neutral spine. The knees can also cave in, which adds stress to the back. On the other hand, too much dorsiflexion is also problematic. Stability is equally important in the ankles, because too much motion due to weakness in the muscles and joints of the feet can contribute to ankle rolling or spraining, along with symptoms of runner's knee. Conventional treatments for supination problems, underpronation. If your orthopedic, physical therapist, trainer or another doctor sees signs of abnormal supination or dorsiflexion in your feet, they will likely recommend improving your form and wearing more supportive shoes with inserts. Changing your sneakers, shoes when exercising is usually the first step, which makes orthotics even more effective. Orthotic inserts used in sneakers or shoes consist of arch support and sometimes a lifted heel to control the rolling forward motion of the foot. They can take pressure off the small toes, and help stabilize the ankle. This is beneficial for protecting the knees and back during movements such as running or lifting weights. Consider using orthotics if your doctor thinks they might be helpful for improving comfort during standing for long periods, for low back pain relief or for reducing heel pain. In the case that pain becomes very bad, you may also want to take an anti-inflammatory medication temporarily, such as over-the-counter ibuprofen, to decrease swelling and tissue, joint inflammation in the feet or ankles. Of course, adding in anti-inflammatory foods and natural painkillers are options, too. Depending on how severe your supination problem is, your doctor might also recommend physical therapy. Physical therapy can reteach your muscles and joints how to distribute your weight in a healthier way, starting from your feet upward, allowing you to sustain proper form all the way through your sacrum, pelvis and spine. 5 natural ways to create proper supination. 1. Fix your form. Here are some tips for helping you to correct your stance, which is the groundwork for learning proper running, walking form. Proper form and posture through the spine are especially important when adding extra pressure or weight to the feet, such as when you're lifting weights or sprinting very fast. When running or walking fast, aim to lower the feet with a soft landing. Some try to image running on eggshells or attempting to run on water. Remain light on your feet.